Good evening, ladies and gentlemen. My name is Princess, and I'll be talking about COVID 19. In late December 2019, in the city of Wuhan, Hubei province in China, there were a reported cluster of cases of pneumonia, and their health department determined that it was caused by a new virus. According to the website Al Jazeera, the UN dubbed this virus as the world's most challenging crisis since World War II. The crisis is known as COVID-19 pandemic. Dr. Tedros Adhanom Ghebreyesus, World Health Organization Director General, held a briefing about COVID-19 on March 3, 2020, and reported that globally 3.4% of reported COVID cases have died. By comparison, seasonal flu kills far fewer than 1% of those infected. As we face these dark times, we ask ourselves, could it have been prevented? The purpose of my speech today is to persuade my audience to help in proactively preventing the further spread of COVID-19. Being aware of the important facts about how to help prevent the spread of the virus will help protect ourselves and our family. I will be talking about the problems, causes, and emerging solutions about the virus. To be able to know more about the severity of this virus, we must first know what it is and what it does. According to the CDC website accessed on April 22, 2020, coronavirus disease, or COVID-19, is an infectious disease that is caused by a newly discovered coronavirus. It causes mild to moderate respiratory illness. Most common symptoms include fever, cough, fatigue, shortness of breath, which can develop into pneumonia and possible death. The WHO Clinical Management on Severe Acute Respiratory Infection published an interim guide on March 13, 2020 about COVID, saying, while the majority of people with COVID-19 have uncomplicated or mild illness, that's 81%, 14% will develop severe illness requiring oxygen therapy, and approximately 5% will require intensive care unit treatment. Of those critically ill, most will require mechanical ventilation. As reported on Johns Hopkins University and Medicine Coronavirus Resource Center, last accessed on April 25, 2020, there are 2,896,633 confirmed COVID-19 cases worldwide, with 202,832 deaths and 816,537 recovered. These numbers of confirmed infected cases grow and deaths grow every day. Scotty Andrew wrote in his article from CNN in April 23, 2020, about the devastating impacts of the coronavirus pandemic. He cited currently 22 million in the US filed for unemployment. Many Americans are struggling right now due to their jobs lost because of COVID-19 pandemic. A story from ABC News on April 13, 2020 featured a family in San Francisco trying to stay afloat. Nick Stamford and his fiancée both lost their jobs due to the pandemic. They shared their experience in their recent trip to the grocery store when Nick told his daughter that they could not even afford to buy juice. He would love to buy her juice, but they could not really afford it. His fiancée further voiced I'm trying to stay positive for the kids, but there are definitely tears sometimes. We just don't know when the next payment will come. Even with the government help Americans are receiving, the help is still not enough to provide food on the table. So those are the problems that the coronavirus is causing our society right now. Now that we know more about the facts of COVID-19, we can take a look at the causes of this problem and why it spreads so easily. Recent studies have shown that COVID-19 is highly contagious and is easily spread either by direct or indirect transmission. According to Harvard Health Publishing from Harvard Medical School, accessed on April 22, 2020, COVID-19 is primarily transmitted through droplets containing virus or viral particles floating through the air. Carolyn Chen mentioned in her article from ProPublica on April 2, 2020, that the way a person can be infected is by breathing in viral particles through the air, especially in an enclosed space with circulated infused air. Harvard Health Publishing further stated that the virus can also be spread when a person touches a surface that is contaminated by COVID-19. If that person touches their face, their nose, and their mouth, it would make it easier for the virus to come in contact with them. If that happens, the virus will attach to their mucous membranes and it will start replicating. Carolyn Chen also mentions in her article that 75% of people who tested for COVID-19 in China initially were not exhibiting symptoms or are asymptomatic, but then eventually went on to develop symptoms of the disease. She cited Dr. Shaman, professor of environmental health, who stated that people who had no symptoms or had such mild symptoms just carry on with their lives, unknowingly spreading or infecting other people in their communities. We as a nation should work hand in hand to defeat this virus. We have to follow guidelines, keep up with the latest news, and be cautious to stopping the spread of COVID-19. According to an article written by Laura Castagnon on March 24, 2020, she cited Professor Vespigiani, Family Distinguished University Professor of Physics in Northwestern University. He stated that maintaining social distancing and avoiding unnecessary social interactions for a longer time are just the first step in slowing the spread of the virus. We need to use that time to increase the capacity in hospitals and increase the amount of testing. This means having teams in place that are able to trace the contacts of infected persons, having the capacity to isolate them as soon as they show symptoms, and creating infrastructures to do tens of thousands of tests every day. Harvard Health Publishing also recommends other ways to protect yourself from the virus, including washing your hands for at least 20 seconds or use alcohol-based hand sanitizers when soap and water are not available. Clean and disinfect frequently touched surfaces. Practicing these will help lessen the possibility of cross-contamination by indirect transmission. We can protect ourselves and other people from getting the virus by staying at home when you are sick or covering your mouth or when you cough or sneeze with tissue and throwing it in the trash, and by avoiding our touching our mouth, our eyes, and our nose. Many COVID many cases of the COVID-19 reports that they have followed the guidelines but still contracted the virus. Since the virus is now community-based, the only thing we could do right now is to lessen the chances of it infecting us. There is no way of knowing who is infected or not infected. There is no foolproof way of not getting the virus, especially when we have to go out of the house and do essential duties. The COVID-19 pandemic has negatively affected our daily lives because we failed to take action early. We could have avoided constantly living in fear and anxiety by going into quarantine and taking our guidelines seriously. Today, I have informed you about the problems, causes, and solutions related to the spread of the disease of the COVID-19. An ounce of prevention is worth a pound of cure. This idiomatic expression holds so much truth to the current situation we're living in. Every hand wash could be our saving act. Every time we stay 6 feet away, do social distancing, or stay at home, we prevent ourselves from getting infected or infecting other people. These measures are there for a reason. As devastating as it has been to our daily lives and to our economy, we need to curb this spread. This way, it would not be you or your loved ones fighting for your lives if you get COVID-19 for not being careful. Thank you.